Today, I want to talk about one important marker that I always include in routine checkups. It's connected to longevity, cancer risk, aging, and even doping control. I'm talking about insulin-like growth factor 1, or IGF-1. Let's break down why it matters so much. A few key facts. In some of the longest living populations in the world, like Okinawa, people tend to have relatively lower IGF-1 levels, not pathologically low, just slightly below the average for their age. This is linked to their diet, lower rates of obesity, and an overall hormonal profile with less stimulation of the growth hormone IGF-1 axis. There's also an extreme example, Laron syndrome. People with this condition have cells that are almost insensitive to growth hormone, so their IGF-1 levels remain very low throughout life. Interestingly, they rarely develop cancer or diabetes, which is why they've become an important model in aging research. However, they don't necessarily live longer. In fact, they may have a higher risk of other conditions, such as stroke. Now let's look at the opposite situation: chronically elevated IGF-1 and growth hormone levels. This occurs in conditions like acromegaly. Without treatment, these individuals typically have shorter lifespans. They develop in large soft tissues, like the ears, lips, and nose, and face increased risks of tumors, diabetes, and cardiovascular disease. So the takeaway is simple: too much IGF-1 is harmful. Too little isn't ideal either. Balance is key. What exactly is IGF-1? Growth hormone is a short-lived signal released by the pituitary gland. It circulates in the blood for only a few minutes. IGF-1 is its main messenger. The pituitary releases growth hormone. The liver responds by producing IGF-1, and IGF-1 then drives tissue repair, muscle growth, bone density, regeneration. Growth hormone itself is more involved in fat breakdown, while IGF-1 reflects how actively your body is in a state of growth and repair, anabolism. The mTOR connection. When IGF-1 levels are elevated, it activates the PI3K-AKT-mTOR pathway, which accelerates cell division. On one hand, this is essential for recovery. On the other, it suppresses autophagy, the process that clears out damaged cellular components. If autophagy is suppressed for too long, cellular damage accumulates, increasing the risk of cancer. This is supported by research. Excessive mTOR activity is linked to diseases of abnormal cell growth, like tuberous sclerosis, while suppressing mTOR in animal studies has been shown to extend lifespan. The logic is straightforward: too much growth, faster accumulation of damage; too little growth, poor repair and recovery. What do human studies show? Large studies, like NHANES and the Rotterdam study, demonstrate a U-shaped relationship. High IGF-1, higher risk of cancer, diabetes, and cardiovascular disease. Low IGF-1, higher risk of frailty, muscle loss, falls, and overall mortality. There's an important nuance. Earlier studies often included seriously ill individuals with cancer, liver disease, etc. in the low IGF-1 group. Once those factors were accounted for, the U-shaped curve remained, but became less pronounced. In generally healthy individuals, low IGF-1 is more often associated with low protein intake, muscle loss, chronic stress, poor sleep. What is the optimal level? The sweet spot is the middle of the age-adjusted reference range. Not the lower end, risk of weakness and muscle loss, and not the upper end, higher metabolic and cancer risks. What affects IGF-1 levels? Lowers IGF-1, low protein intake, weight loss, sleep deprivation, chronic stress, liver disease, chronic inflammation. Raises IGF-1, adequate protein intake. Regular exercise, especially strength training, good sleep, reduce stress and inflammation. What you should not do: don't try to artificially lower IGF-1 for longevity. And don't try to increase it with growth hormone for anti-aging. Too low, muscle loss, weakness, impaired immunity. Too high, especially artificially, risk of diabetes, fluid retention, and cancer. A quick note on doping: growth hormone is difficult to measure directly because it fluctuates rapidly and disappears from the bloodstream quickly. That's why IGF-1 is often used as a proxy. It's more stable and reflects overall activity of the system. Another marker is P3NP, which reflects collagen synthesis stimulated by growth hormone. Together, IGF-1 and P3NP significantly improve the ability to detect growth hormone use in sports. Final takeaway, IGF-1 is not just a number on a lab report. It reflects how well a key system in your body is functioning. Growth hormone, liver, repair and regeneration, and like many things in physiology, the goal isn't extremes, it's balance.